luck is the intersection of opportunity and preparation. You'll learn as you go on that it becomes less and less and less about the product and more about the value that you deliver as an individual. Ambulatory surgery centers and specifically outpatient surgery are exploding right now. It's a mega trend in the market. The outpatient shift right now of surgery that moves out of the hospital into the surgery centers over the next 5 or 10 years, it does represent the largest displacement of revenue that health systems have ever seen, pretty much in the entire history of health systems. It's a big, big migration.
Ryan Aldridge, Vice President of Business Development with Atlas Healthcare Partners. Really appreciate you coming in today. Very excited to talk to you about your past as a medical device rep and leading into your role at Atlas. So thanks for coming down.
Right on, Mike. Thanks for the invitation, man. Happy to be here.
So let's jump right into it. Have a lot to talk about. Let's start with your story. You know, you're currently the VP of Business Development for Atlas. But before that, you spent almost a decade in medical device sales with Medtronic. So can you walk us through your story, how you got into medical device sales, and ultimately how you transitioned from med device over to Atlas?
Absolutely, man. So, yeah, like you said, I've been the Vice President of Business Development with Atlas Healthcare Partners since about September of 2018. But, going way back prior to that, I did my undergrad in Santa Cruz, California, at UC Santa Cruz. While I was there, I've, like a lot of people, like a lot of students, just trying to figure out, what to do next. And I was always interested in science and human science and healthcare. But, instead of going like the lab rat route, I really wanted to focus on helping people. And, I was a social person, wanted to get into sales. And so that helped me transition really. My first job was to get in sort of a startup environment in a naturopathic pharmaceutical type of sale. While I was there about a year, I really just realized that my passion was more working directly with patients and really in the operating room. And so I did everything I possibly could at that time. I actually thought I wanted to go to med school, but I went to an orthopedic office and just asked to shadow a surgeon. So I got to see some sports medicine cases. I just volunteered, did all this for free without any expectation of anything. But just one theme that I think you'll get as you listen to this is anything that you feel passionate about and you want to do, whether it's medical device sales or selling cars or whatever it is, you got to jump in and immerse yourself in the industry, especially if you don't have any experience. And that's kind of what I did. And so I jumped in, I volunteered in the emergency room at the community hospital late at night, just found my way in there, started shadowing surgeons, just asking for it to go in the operating room. And then while I took a job as a medical assistant, after I left that first job I had out of college in that orthopedic office, and just kind of learned the ropes of healthcare. And one day a medical device rep walked in. I forget what company he worked for. I think it was a cardiovascular company. But on the way out, man, after he did his in-service during lunch, and I was looking around, and I learned about his exposure in the operating room and talking to patients, and I was like, dude, that's really everything that I want out of healthcare. So I just followed him out, tapped him on the shoulder, and said, I want to do what you do. And that would be lesson number one, sales. Like, go figure out where to get the information you need and go ask for it. And he was just, I think, so thrilled that I went and followed him and asked for his basically black book. He gave it to me. It was a list of over 100 recruiters, and at that time, it's different now, but I went through and cold called all of these 100 recruiters and sort of just talked myself into an interview. One thing led to another, and I wasn't getting a lot of traction, and I finally just hit this one recruiter, and I just told him, man, get me in front of somebody. You don't have to worry about my experience level or polish or anything else. I'll handle the rest. And he did. And I had my next interview, my first interview with Medtronic, when I was 24 years old in Northern California. 4 months later, 6 or 7 interviews later, I landed my first job as an associate clinical specialist with Medtronic in the neuromodulation division in Northern California. And that was really my entry into medical device sales. Fast forward, did that for 4 years. I got to a point where I wanted to get out of the clinical side and get really into more of the lead sales rep, senior rep, territory manager. Simultaneously, if you look online, my LinkedIn, you'll see a Goalcast video that I gave a speech about this specific situation where I had a boating accident. Crazy. Yeah, I won't go. It's a long story.
Yeah, I'll put a link in this interview to your video, because I think it's really inspirational, and it's a pretty crazy story.
It is kind of crazy, but it helped me sort of lesson number 2, right? So it helped me realize that look outside the box, right? If you need to relocate to get what you want, to get to a different position, the sky's the limit. As soon as you open up your mind and start looking at all the possibilities, your career can really take off. And one thing led to another, and I applied for it and earned a position as a territory manager in Phoenix. Moved here in 2013. Did that for 5 years. Along the way, I went back to school at ASU, WP Carey, got my MBA in healthcare sector management. Again, after I got my MBA, wanted more of an executive experience. And through my experience as a medical device rep, I met a couple founders that had broke away from USPI and had ran and developed some of the surgery centers that my physicians were operating in. So I knew the business, knew the model, and they were just looking for a head of their physician recruitment, physician sales team. And it was just, it was a good fit, good timing, good match, and I've been there since 2018.
2018, so going on 4 years now.
Going on 4 years, yeah, about 3.5 years into it.
Yeah. Well, there's, you have quite the story. I think just from the beginning, the initiative and the networking that you displayed to get into the industry, and I think your willingness to relocate, how bad do you want it? That's the kind of sense that I get from you. We've never met before, right? I've just communicated with you on LinkedIn. Yeah, that's kind of the type of person I see.
Yeah, Optima, know about you. You've done great things in the market out here. Got a lot of respect with surgeons, so it's good to sit down with you today.
Yeah, definitely. So, transitioning over to Atlas, describe who Atlas is and what your role is. What do you guys do?
Totally. So Atlas Healthcare Partners was an idea, but technically went operational live in January of 2019. And it is an ambulatory surgery center management and development company. Ambulatory surgery centers, and specifically outpatient surgery, are exploding right now. It's a mega trend in the market. There's a lot of reasons behind that. A lot of it is motivated by payer dynamics, and so there's a lot of incentives driving outpatient eligible cases to a lower cost site of service, which is, in this case, is surgery centers for whether it's orthopedics or spine. Cardiovascular is a big one. It's across all of these different specialties and service lines. What we do, and there are different models out there for surgery centers. I mean, as an enterprise, you could build a surgery center as a physician and then have it be 100% independently physician owned and run it. What we do is we go to large health systems, integrated delivery networks, integrated hospital networks, systems, and we form joint venture partnerships. So we really partner with the health system. That allows us, in partnership with the health system, to bring a lot of competitive advantages to support the surgery center footprint. It simultaneously helps our health system partner really get ahead of this trend to this move to the outpatient surgery. Traditionally, most surgery has been done in the hospital, so they're grappling with how do we relocate? How do we wrap our arms around the shift happening from cases leaving the hospital to going outpatient? We want to be part of that. Atlas is a solution for the health system in order to develop their geographic footprint and access points to be able to serve the patients and the physicians and the communities that they serve. That's what Atlas does. What my team does is we're essentially business development, sales with a little bit of marketing mixed in. Our job is to go partner with surgeons in the community and bring all of those competitive advantages that the partnership with the health system brings, and form, really first provide a good space for them to do outpatient surgery, high quality, at a good cost for their payers and for their patients, but also provide them the opportunity to invest if they're eligible and they're the right fit, and that's something that they want to do. Mm-hmm. So recruit surgeons to come to the center. That drives the case volume and the revenues for the system and the surgery center. We also look to expand and bring in new service lines, so ways to optimize or grow the existing partnership that's there, whether it's bringing in, for orthopedics, bringing in total joints, for spine, bringing in single level fusions, potentially double level fusions down the road, different cases, different types of case mix, and diversifying that case mix to drive the overall profitability for the center up. The third thing that we do is partner with the health system and the physicians as well, to work on network alignment. And network alignment is really taking the entirety of that integrated delivery network, whether it's the ancillary services such as physical therapy, imaging, toxicology, DME, all of these things that health systems do, and then helping the physicians in the surgery center plug into that so that there's really sort of a synergistic mutual benefit for everybody, so that everybody grows and all boats rise with the tide.
Mm-hmm. Yeah, there's a lot going on, certainly. Can you describe, because some of our listeners are new to the medical industry, so can you describe the difference between a hospital outpatient department, and an ambulatory surgery center? Absolutely.
So those are three different, I think that the technical language is the place of service. Place of service is a code, right? So it's a reimbursement code. It's also really a clinical care site. So a hospital, an acute inpatient hospital, is the traditional model. I mean, hospitals were built, there's inpatient ORs. If you're a patient and a surgeon, you go to an inpatient OR. You have all of the different life-saving modalities that are there, care, if something, God forbid, something terrible happens during your surgery. You've got doctors of all different types of specialties, critical care, nursing staff, life support systems to take care of you. One of the downsides, so a couple pros, like you've got everything there to take care of you. Some of the downsides is it's massively expensive to do that, and it's massively inefficient for the system to be able to take care of outpatient procedures in that setting. So what hospitals did is they constructed HOPDs, which are the hospital outpatient department. You can think of that sort of as same-day surgery. And so they'll have a wing where it's a separate set of operating rooms where they'll look at surgeries that could be discharged the same day or within, basically they call it less than 24-hour stay. And that is still something attached to the hospital. Those patients can be admitted to the hospital, but it's a slightly lower acuity level surgical site, but it's also a cheaper side of service for the payer. And really it depends on the type of contracts the system has, but it is sort of the first tier of value-based care. It's a lower cost side of service for the hospital, but it's also provides you sort of this intermediate benefit of still having some of the direct access to the hospital if you need it. Then last is the ambulatory surgery center. So ambulatory surgery center there's a term called the focused factory. Now, we don't like to think of healthcare as a factory, but the idea with a surgery center is you focus specifically on a subset of outpatient procedures. The team gets really, really good at those types of procedures. Therefore, you're able to do it much more efficiently, much more cost effective, and have a highly specialized focused team that's able to provide really high quality care in partnership with the physicians and really high quality outcomes, while simultaneously lowering and bending the cost curve for payers and for ACNs and other organizations that are responsible for the patients as well, actually, their deductibles and copays. And so it's, cheaper is never a good word, but in this case, it is sort of the intersection of quality and value.
Yeah. Less expensive.
Less expensive,
yeah.
Yep.
Better
Less
care.
expensive, better, and as good, if not better care, and for the right surgery, overall, just better experience for the doctors, and typically a better experience for the patient and their families to be able to go in, get the care that they need, and go home the same day and recover in the comfort of their own home. So
with Atlas, how many surgery centers have you guys developed so far?
Good question. So when the partnership took off in January 2019, we originally took over a total of 8 locations. There were 6 locations in Phoenix and 2 locations in northern Colorado. Since that time, right now we have 25 operational centers in various stages of ramp across Arizona and Colorado. We have a pretty rich pipeline as well. And And anyway, I don't want to disclose the pipeline, but there's a lot of growth in this market too.
So with COVID, right? I think a lot of patients are unwilling to go to a hospital for fear of, being exposed to COVID patients and that sort of thing. Obviously, that's probably had a huge impact on your guys' growth, right?
It is, yeah. So what we saw, it's a couple factors. What we saw during COVID, during the pandemic, was we had to shut down originally, and then we were worried about business recovering. As soon as it recovered after about 2 months of shutdown, we have been on this hyper growth trend ever since then. And the reasons for that, I think, the healthy patients that are out there that need to go in and have an ACL repair or something, cataract or something like that, realize that the hospital is really reserved for sick patients, right? That's where you go if you're sick. If you go to the hospital for a surgery, you risk, being in a building with COVID patients during a pandemic, other sick patients. If you went to a surgery center, we had protocols in place, infection prevention protocols and process and everything, so that we were really focusing on keeping the healthy patients healthy so that they could get a surgery and move on. And I think the adoption of the surgery center in the patient's mind has really taken off during the pandemic for those reasons.
Mm-hmm. Yeah, no, that's great. I know if it was me, I would prefer to go to an ambulatory surgery center. So looking at, integrating with health systems, delivery networks, value-based care, again, for those that maybe aren't as familiar with those terms and those models, can you describe how Atlas provides value-based care, how you integrate with ACOs and that sort of thing?
Totally. So that's part of the integrated delivery network, right? So when you're a large health system like Banner, so we're partnered with Banner Healthcare in the Arizona and Colorado markets. They're not only hospitals anymore, but they're an entire care continuum for a patient, right? So if you are a orthopedic patient with knee pain, you can see a Banner physical therapist, you can see a Banner orthopedic surgeon, you can go to a Banner hospital, a Banner surgery center, you can go to a Banner imaging center to get your x-rays. And by the way, you may also have Banner insurance plan as well. So the surgery center, and the reason that they're on such a mega trend is it is a value-based care site of service. It is the least expensive site of service for both the patient and the payer, where you can still have a better experience and very effective surgery. So in and of itself, we're really attractive for that reason to payers, mm-hmm. whether it's the ACOs of the hospital system, or whether it's Optum, United, Blue Cross Blue Shield, Cigna. All of these mega payers that are out there know that we can do surgery safely and effectively and save money for the patient and for us by doing them in these surgery centers. And so the way that we work, we have a team that works and directly contracts with all of the insurance payers. We have a whole managed care division. And I guess I would state, I don't remember where the white paper I saw was, but the outpatient shift right now of surgery that moves out of the hospital into the surgery centers over the next 5 or 10 years, it does represent the largest displacement of revenue that health systems have ever seen, pretty much in the entire history of health systems. It's a big migration of both revenue and profit. And so we work with the health system to help them, sort of as a consultant, help them to navigate those waters. And we work with the payers to sort of optimize different value-based structures, whether it's a bundled pay for a total joint, or whether it's sort of capitated payments, or whether it's just looking at the total cost of care or the per member per month fees that patients pay, using different providers at different sites. All of the health organizations, especially payers, are able to look across the market and figure out which providers are really high quality, but also are able to bend the cost curve. And so what we're seeing is more and more surgeons graduate medical school and come into the community is, for better or for worse, these doctors are being stack ranked based on certain metrics, and mm-hmm. typically they're value-based care metrics. That's where the industry and that's where the healthcare is really headed. And as that happens, and as you get a surplus of physicians, surgeons in a market, that exceed the number of whatever you would call like a patient saturation point. Networks start to look at it and go, what surgeons do we actually need in our network versus which ones, are we based on quality metrics and other things may not need. And so it starts to become this inclusive environment within a health network or an integrated delivery network of strong partners. And partnership is, quality gets you in the door, value-based cost gets you in the door, efficiency gets you in the door, outcomes, and then total alignment with what the system and what the partnership means. And that's the surgery centers are a small piece of that. Health systems are it's everything in healthcare. There are Banner, Honor Health, Dignity Health, everyone in this market is looking to move as fast as they can to consolidate all those services and serve as many patients as possible.
Yeah, and I want to talk about developing partnerships with physicians. You mentioned orthopedics, spine, pain management, cardiovascular is really kind of your main focus, it sounds like. I'm sure there's other specialties. And you're looking for quality, value-based care delivery. So how do you, seek out and how do you, determine what physician is a good partner for you? Do they have to take certain insurances? What sort of metrics do you look for?
Good question. So, it does vary, and it really varies by service line. Clinical care, quality, and outcomes, I think, stick out, beyond everything else, right? If you're a great surgeon with a great brand, great reputation, and you drive great outcomes, everybody wants to work with you, not just us, right? After that, we're looking for similar to health systems, but also, we're a growth company. So we're looking for groups and physicians that have ambition to not only partner, but want to scale and be able to provide more geographic coverage and regional coverage. We want to grow with our partners, and so we could help them strategically relocate to different neighborhoods, different markets. The utilization is looked at as well, right? So are the vendors, the supplies that you're using, are they within an expected market range? Are there outliers on cost? Those things, unfortunately, in this environment today, even coming from the vendor side, those are things that we look at, right? Because we are looking at managing margins in the surgery center. So that's part of it. How long do your cases last? So that's another benchmark. If you're doing, whatever the case might be, and the bell curve states that 70% of those cases should fall within 90 minutes, but it's 3 hours long, that's also another value-based care factor that extends the overhead and the cost of delivering care in that side of service. And so, it's all these kind of things. It's a willingness to partner. It's a willingness to expand. In partnership means, also looking at alignment throughout the entire system, not just picking at the surgery center as well, since we're a health system partner. And then how you utilize. And it's sort of this total package. There's not like a rubber stamp, one size meets all. It's just sort of an evaluation and one provider at a time.
Yeah. So let's say there's a orthopedic surgeon, spine surgeon that has only ever performed surgery at a hospital. Would that preclude them from partnering with Atlas?
Not at all. I think we're seeing that fairly commonly right now. We see that a lot in cardiology and spine and some of these other areas where they traditionally have not been surgery center based specialties. So what we look at is there's an inpatient only list that Medicare CMS publishes, and CMS is the Center for Medicare and Medicaid Services. It's really the driving force behind what's clinically, I don't know if clinically appropriate is the right term, but what's allowed to be in a surgery center, and what the expected payment for that would be. There was a lot of discussion because they took a lot of spine and cardiovascular in a lot of cases off the inpatient only list a year or so ago, and then they re-added a lot more recently. But there's still a broad range of spine and cardiovascular, peripheral vascular cases really that can move out. So what we look at is, what can we do? What are we allowed to do? And then how can we do that safely? And so our job is to bring and connect with physicians. We want our service line protocols to be physician-led to optimize for safety and quality in the surgery center. That's one thing I do want to stress is, as a partnership, we're partnering with surgeons where they are on a board. There's a clinical governing body. There's a medical executive committee where they're making decisions about the clinical care of their patients in that facility. And we want to build protocols that are safe and effective and that serve the doctors in parallel to the doctors. Yeah. So I don't know if that answers the question.
Yeah, no, definitely. And you mentioned the Medicare inpatient only list. One specific procedure that, we support a lot is lumbar interbody fusions, right? And I believe this past year, Medicare said we're going to take this lumbar interbody fusions off the inpatient only list, and maybe in a year or two, it can be performed at an ambulatory surgery center on Medicare patients. But then they reversed the decision, I think, late last year. What's your take on that?
It was perceived originally as a shot to, I think originally it was perceived as something that was a huge risk for hospitals. And then when it was put back on the inpatient-only list, it was looked at as a barrier for surgery centers. I look at it as a theme, as just the state of the market. Hospitals, physicians, CMS, payers, everybody's looking at what's clinically appropriate to do in the centers today. What can we do safe and effective? Long term, I think that's kind of short term. Long term, no doubt in my mind that it's going to come off the inpatient-only list and everything is moving out a matter of over the next 5 to 10 years. Yeah. I think it's not a matter of if, it's just a matter of when.
Right. Yeah, and I think, ambulatory surgical procedures, they've been around for a while, but for spine, it's relatively new. I feel like, at least the fusion side of it. So I just expect the payers to kind of look back 5 years and really look at the data and the safety and efficacy of doing these procedures before moving forward and taking them off the inpatient-only list. So I want to transition a little bit and talk a little bit about medical device sales, your experience, and advice for medical device reps. So with medical device sales reps, you spent almost a decade at Medtronic, right? I guess starting out for people looking to get into medical device sales, what advice do you have? I know you talked about, your initiative and how you network to get into the industry. Can you talk a little bit about, your advice, interview tips, that sort of thing?
Totally. It's a much different world than when I got into it in 2009. I mean, things have changed. Digital technology's changed. The way that you network has changed. Getting a black book and a list of recruiter names written in hand is probably not really the vehicle of choice or channel of choice to do that anymore. But the methods are still the same, right? So I feel like it's almost a rite of passage for anybody that networking is key. So I think just career lesson, figure out what you want, and I looked at pharmaceutical sales versus medical device sales when I was first making the decision. I think there's a lot of really good training if you decide to go the pharmaceutical route. And if you remain in that, there's a lot of people that make great careers in pharmaceuticals. Pharmaceutical companies have great training plans, but if you want to get into medical device, there's no reason you can't do it from the very beginning. But it's going to take making a decision and a commitment that this is the goal, this is what I want. You got to have a ton of grit. You got to figure out and just network with everybody and talk to everybody. The more connections and relationships that you build, the opportunity is going to lead to another opportunity for another conversation, to another conversation. Eventually along that way, part of the learning process is you learn how to sell yourself. And really in medical device and anything, you'll learn as you go on that, and really in any industry, you'll learn as you go on that it becomes less and less and less about the product and more about the value that you deliver as an individual or to that provider's practice outside of the product. Mm-hmm. And that's really what that's why they use you ultimately is because of who you are and what you bring. Mm-hmm. So the lesson there is do that early on, develop those skills. And once you get in, I think it's one of those industries that once you land and just soak it up like a sponge. I use the term gritty because that's always how I thought I was. I mean, just get in, immerse yourself into the industry. You can't start in an industry unless you jump in with both feet, both hands, and start swimming. So even if you're doing it for free, you're shadowing, you're getting experience in the operating room. When you sit down in an interview, you can tell an interviewer, hey, I've stood in the operating room. I'm not going to pass out. I've watched a surgery, right? Mm-hmm. Like, those are all important things to have. So, that's just getting into the industry. Just talk to as many people as you can. Figure out who the hiring managers are. Reach out to them on LinkedIn, social, other channels, and just keep going and don't stop until you land your first position.
Mm-hmm. Yeah, and what I tell younger reps, and I'm curious to hear your experience. That first 6 months, year, maybe even longer, it takes time to develop trust with a physician, with the staff, and so I think that there's a lot of people want something right now, so I think they have to be willing to go through the process, take their lumps, and then ultimately they'll get to where they want to be. Because you've probably seen it where people get into medical device and maybe after a year they haven't got to where they want to get to, and they transition into real estate or something else. And so what I tell people is just whatever industry you go in, and I think you're alluding to it, you have to dive in. You have to decide what you want to do and just be a subject matter expert, right? And that's something, I think you had a post yesterday or something that I really liked, where you're talking about your 2 different pool service guys. Yeah. And I think that goes back to the book, The Challenger Sale, where you really have to, in medical device sales, you really have to understand what the physician is trying to achieve, right? To be a valuable partner to them.
You said a lot there, Mike. So couldn't agree with you more. In any healthcare industry, I think it takes 6 months before a physician trusts you and just trust that you're not going to go somewhere else and keep showing up every day. So 6 months in, you got to earn trust. You got to earn it, right? Earning it is the big theme. In this industry, you're not going to get anywhere unless you do the work and earn it. It takes you about 12 months probably to actually be, operational and self-sufficient without somebody looking over your shoulder to do the job. By the end of year 2, you have reached probably not quite mastery, but you will be totally independent, be able to handle a lot of the objections and questions that you may never even thought of that you're going to get in the operating room. And then during year 3, typically you'll reach that level of becoming an expert and actually achieve a good amount of success. But yeah, as you put it, the best way to earn it, and especially now more than ever with the state of market. What's one thing that COVID did is it's really, I think, elevated the role of marketing, because the access is restricted to these offices, and so you need to have physicians come with some type of notion of what your product is and have already kind of made a decision by the time you get there. Mm-hmm. When you show up and after you've earned that trust, teaching and educating the doctor on their business. I mean, it's one thing to talk about, here's our widget, here's what it does, X, Y, and Z, and they're going to look at you and roll their eyes and go, I've heard it 1,000 times. Right. But if you can bring them something that's valuable, that's more relevant than anybody else, and teach them something to think differently about the way that they're doing their business that makes them more successful, they're going to want you coming back every day. Well, not every day, but they're going to be happy to see you when you show up, because you add value and they know that you're a valued partner to what they're building. Yes. And that's the most important part, in my opinion. Absolutely.
And so can you touch on that a little further in your career at Medtronic in neuromodulation? What were some of the, some of the activities or what was some of the value that you provided to physicians that made them really trust you and want to work with you?
So I think one of the ways that I always approach my business, just at a foundational level, is early on I wanted to persuade and influence, and I think that's part of what the role is. But you have to do it from a place of authenticity and realizing that you have to put their interest first, right? If you walk in and it's always just about you and you don't establish that trust, you're never going to get anywhere. So that's number one. If the product's not right for their patient at that time or their practice at that time, let them know, like, hey, I'm not right for you today. It's okay to say that. It's not, you're going to end up earning the sale in the long term, because if you do a case where the product's not right, the right time for the right patient, and you have a bad outcome, in neuromodulation, I had to deal with it, right? Mm-hmm. So I earned, I think, a lot of respect and trust from putting the patients and the practices first early on. And then as I grew up and I learned more, one of the things that you can add as a rep to the practice is the overall landscape. So when you show up at a physician's office, hey, I'm not a physician, but I see all of these other large practices doing this specific thing from a practice management, practice development standpoint. whether it's patient workflows, prior authorizations, patient selection, entering data in the EMR, like all of these different things that you can look at, right? That you see and you take their practice. Say, hey, I noticed you're doing something. I think you'd be more efficient, and efficiency usually equates to overhead in their minds. Save some money by doing things this way or streamlining this. Another way that we brought value, and this kind of just goes hand in hand, is, hey, you want to get yourself out there in the community and market yourself as whether it's a thought leader, just a regional presence, a clinical leader, or just grow your practice. Here's some marketing strategies. Here's some tactics that you can take to grow your practice. I'm willing to partner with you and have a conversation like, how can we grow your practice together? Huge value add if you do it the right way and you bring value doing that. And then one of the reasons, and this is kind of what I learned later with my role with Medtronic, the overlap with facilities and surgery centers, right? And so doctors are CEO. A lot of doctors, and the ones that you'll be working with, are CEOs, right? They're clinicians, but they're also CEOs of a small to medium-sized business. And they're also going to be looking at not just your widget, they're evaluating different widgets for when their patient comes through the door. There's what types of different devices, what types of services, what types of things do I offer this patient that are right for the patient and their stage of their disease progression. And how can I increase the overall valuation of my practice? Does that mean I need ownership in a surgery center? What are the different ownership structures? Mm-hmm. What does that look like? Does it mean I can bring in-house a certain type of ancillary service, whether it's a DME that I provide, or whether it's toxicology that I provide, or it's there's so many different things depending on the practice you're in, whether you're a pain physician, spine physician, orthopedic physician, that are available now that you can bring into your practice. And I know I'm being long-winded, but the idea is the more that you understand about the industry and you understand the business for that physician better than they understand it, and you can come and now be a consultative force with that doctor and say, hey, here's what I'm seeing. Here's something that you could do that's really going to make you stand out in the crowd, and your practice is you're not only going to take awesome, potentially better care of your patients, but you're also going to achieve more profit as well. You'll have that conversation 10 times out of 10 and ask to be coming back to the practice all day, every day. So.
Yeah, I think that sums up what a medical device sales professional is, right? Everything you just said. Medical device reps, we have a unique perspective because we are in different operating rooms. We're in different practices. And like you said, pick up what's working at these other facilities, other practices, and bring it to your customers. And then another thing you touched on is, and I'm curious to get your feedback now that you've transitioned from Medtronic to, the surgery center space, looking at medical device products. One thing I've always said is that if you have 5 products and they're all under the same CPT code, to me, they're all pretty much the same, from the surgery center or hospital's perspective, because they're going to get paid the same amount on that. So, going away from kind of the medical device rep conversation back to your role at Atlas, how do you guys evaluate, these medical device technologies?
Good question. So I'll try and be one of the reasons I wanted to go and I was really attracted by the surgery center facility space is in medical sales, it's interesting. There's sort of this 3-way dance, right? So you've got the doctor, you've got the medical device representative, the supplier, and you've got the facility. Typically what's happened in the past is the medical rep and the doctor partnered up. Because the doctor really didn't have a lot of vested interest or ownership in the facility. And so prices were high, and partnerships were strong. What we're seeing now and sort of the trends in the industry is that as more physicians have ownership in the facility side, now the economic customer, not the clinical customer, they're aligning more on cost and looking at, the 5 different types of products that are available under CPT code and going, if it doesn't add meaningful clinical or meaningful economic value, then it's a commodity at the end of the day, right? Mm-hmm. And therefore all the price should be the same. The way that a facility is going to look at the differences in products, clearly if there's a relationship there, that still is, if you can form tight relationships with your doctors and that doctor is a high value, high quality add to that facility, that's great. As that becomes tougher and tougher to maintain, the facility is going to look at, hey, depending on the price, is there a special clinical feature that, patients, and there's a long conversation here as incentives become more aligned, value-based care and hospital readmissions become potentially tied to the surgery center. They're not right now, but that's going to be looked at some point. Does your product prevent that patient coming back down the line in their continuum to receive less care, therefore lowering the cost for continued treatment for that patient? There's no good data on that yet, and we're not, the industry isn't tracking that, but I see that coming in the next 10 years. And I think facilities, surgery centers are going to look at that. Is there truly a clinical advantage? Do patients really do better? And does it justify paying more because the patients do better? Therefore, the center is going to have a better halo effect as a center of excellence. Or B, does the patient get better, therefore minimizing the costs to our health system partners down the line by using this type of technology in our surgery centers? And if so, then maybe you can charge a higher cost up front because you're saving cost further down the spectrum.
Yeah. No, there's a lot to it for sure. And getting back to your point on becoming a partner with a physician, not only clinically, but, from a business standpoint as well. What can medical device suppliers offer, not only from the device standpoint, but from a therapy awareness standpoint, business development standpoint, that sort of thing. So I've heard of a couple groups out there that have offered guarantees, right, with their medical devices. And I'm blanking on, I want to say, and I could be wrong on this, Right Medical, I think, had some sort of guarantee. And then I know there's a medical device distributorship out there that offers a guarantee if a physician utilizes one of their products and they have the patient needs to be readmitted within that 90-day time frame, then they will refund the facility the cost of that implant. Have you seen any of that in your experience at Atlas, and how is that navigated from a legal and regulatory standpoint? Because I don't know much about it.
Man, that's a loaded one. I haven't seen that a ton within Atlas. I don't think that it's matriculated its way into the surgery center, at least our space, quite yet from the vendor, from the supply perspective. I have seen that with hospitals and groups, and there's such a thing known at, depending on the service line, there's such a thing with health systems and facilities called co-management, where a group of specialists or a large type of organization will partner with a payer or partner with a facility and work to generate, just basically standardize things to generate strong outcomes and simultaneously lower costs. Whether it's to a payer, whether it's to a facility, it benefits both, right? And one way that they can do that, and it's called risk sharing, right? So if you're going to guarantee a product, what's happened, maybe taking a step back, what's happened in the past is suppliers will sell a product and then basically be risk-free, right? And we all know that there's tons of different reasons why when you do a surgical case, there's so many variables about, is it the product that potentially didn't work for the patient and failed? Is it an infection? Is it, that potentially the product was not implanted in the correct location, the correct orientation, according to the book, right? Mm-hmm. All these different factors go into it. But typically and traditionally, suppliers have been risk-free, right? And that burden has been passed on to the facility mostly and the physician. And so now what we're seeing are hospitals, health systems, payer networks going to the suppliers and saying, hey, if we're going to be utilizing a ton of this, we want to see some risk share here as well. So we're not footing the entire bill for this. And that is a portion and part of the value-based care. I haven't seen that in the surgery centers. Mm-hmm. I wouldn't be surprised if that's something that evolves down the line.
Yeah, no, it's very interesting. So Medtronic, 10 years, and then transitioned out of the medical supply side into the hospital or ASC side. So there's a lot of different career paths that you can take as a medical device rep, right? You can transition into leadership with one of the manufacturers, or like you can transition into the surgery center space. So how were you able to make that leap?
So I'm a big fan of diversification, whether it's a product offering or whether it's just your personal brand. So I definitely looked at the leadership track with the medical device and wanted that for a long time. And I still think that's a wonderful direction to go. This opportunity just kind of presented itself. The way that, whatever role that you take on, you always want to stay consistent with your personal development, because just because you're in a place right now doesn't mean the market's going to not move around you. The situation's going to change, reimbursement's going to change. If you sell one product, you're always one reimbursement change away from potentially being out of a job. So I went back to school, did my MBA, finished in 2017 as a way to just give myself more options, opportunity, but also develop my business acumen and understand more of, from the trying to position yourself as sort of a sales rep that's also has a CEO mentality. Like, you're running your own little business, right? If you do that, you can help your surgeon partners run their business. And then when the time comes and a different opportunity presents itself, you're going to have a different skill set that you can add value to a new organization or do something different. And that's kind of what happened with me. Is I met a group of founders that had a vision, had a great vision, I think, for this where the state of healthcare is. And based on everything that I had built myself up to in that point, differentiated myself through school and through personal development and just sort of being ambitious and taking on new roles with greater accountability, allowed me to have some really great conversations at the time with them. And this move outside of medical device didn't mean that, I was 100% looking to exit medical device at that time, but I had come up with a set of criteria for the next role that I was looking to advance into. And this one met all those factors, plus it allowed me to add one more sort of diversification node to what my background was, and move out of medical devices into the world of facilities and health systems and joint venture partnerships and just sort of all this other stuff I learned. Always stay hungry and keep learning. You never stop learning, because you never know something that you learn you're going to be able to apply in real time the next day.
Yeah. No, I think, investing in yourself, right? All the MBA and all the other personal development things that you did allowed you to be on that stage, to be considered for the role that you're in now, right?
Yep. And there's a quote that I botch every single time that I use it, and I can't. I'm gonna butcher it again, but maybe I won't. So I think luck is the intersection of opportunity and preparation. Prepare like nobody else. And when the opportunity presents itself, you create your own luck.
Yeah. We'll start wrapping this up, but you completed your MBA, doing a lot of different personal development stuff. How are you investing in yourself now? Like, what are you reading? Who are you following? Like, what's your sort of personal development track as it stands today?
Good question. So, man, there's always more that I can do, but I'm learning. So based, I think, on the role that I'm currently in, I'm not just looking at the surgery center space, and I'm looking at payer trends, right? So the inpatient, outpatient list that we talked about. What's coming down the pipe in 5 years? What does our organization need to be ready for? And there's a lot of things that we do on the back end, from contract negotiations with payers, being ready in the centers to absorb those types of cases as they become eligible, and just looking at those trends. And so it's a lot of trend analysis, doing research on that. The other place that I've immersed myself into, just by default in the nature of what I'm doing, is I'm learning about all the ancillaries in a health system. What is the patient flow for? How does a payer, how does an insurance company, when they look at a provider and a patient, evaluate, what does that patient's journey looks like? And I think sometimes as a device rep, you get so fixated on your product and your niche that you kind of lose picture, or you lose focus on the big picture. Mm-hmm. So I like to study the big picture from the health system perspective. It's new to me within the last 3 years, but it's essential. And that's connecting all of the dots in healthcare is really where the industry's going. And I pick up my device and I read HBR articles. I've got a subscription to Harvard Business Review in the healthcare section. Modern Healthcare is another one. somebody that I listened to a podcast turned me on to Blinkist. I think it's called Blinkist. It's a podcast. So if you're wanting to absorb a book, but you want to absorb it in an audio in like 15 minutes, short increments, I'll listen through that. I'll listen to leadership. Gosh, man, there's so many books on there. It's like Range was one that I picked up recently. I can't remember what the author is, but in any case, I look at all these different things. I use them all, and I just try to absorb them all every different day.
Yeah, no, you're a great example of being a student of the game, I think, and that has allowed you to take advantage of opportunities that have come your way. So really appreciate your time coming down here today. Glad we had a chance to meet and talk a little bit. Before we go, I know you already gave us a quote, but do you have any other parting words of wisdom?
Only other parting words of wisdom is whatever place you're starting from today, don't ever give up. When you look back in 10 years, you'll look back and go, man, that was the easy time. And if I would have known that all of this other stuff would have panned out for me, I would have never doubted myself that day one.